The truth about turmeric benefits, science-backed tips for optimal results. Turmeric is not only an essential component of Indian cuisine, but it is also referred to as the wonder spice because it possesses powerful characteristics that are beneficial to us in a variety of different ways. Since the beginning of time, it has been utilized as a medicinal herb. In addition to being abundant in vitamin A, thiamine, B1, riboflavin, B2, and vitamin C, dry turmeric also contains a quantity of calcium, phosphorus, iron, salt, and potassium in sufficient quantities. When it comes to the natural compounds found in turmeric, curcumin is by far the most researched of all of them. Even though some of turmeric's many volatile oils and natural aromatic oils, including several different kinds of terpenes, appear to offer benefits as well, the pharmacological or biological effects that turmeric causes in humans appear to originate from this curcuminoid, which is a form of polyphenol. Curcuminoids are molecules that are used as a medical spice to cure a variety of ailments and illnesses that are related to turmeric. Recently, the scientific community has been doing research with clinically validated studies, claiming that turmeric includes these components. Anil Khandelwal, a health and wellness expert at Yogic Secrets, discusses the benefits of turmeric that are supported by scientific research. There is a great possibility of protection against Alzheimer's disease. According to the findings of several studies, curcumin may have beneficial effects on Alzheimer's disease. To begin, and most importantly, curcumin appears to both inhibit the production of rogue proteins, beta-amyloid plaques, and encourage their disintegration. These plaques are characteristic of Alzheimer's disease because they accumulate between nerve cells in the brain and interfere with their ability to communicate with one another. In the end, the nerve cells perish, which causes irreparable damage to the cognitive system. In point of fact, Aduhelm, the most recent pharmacological treatment for Alzheimer's disease, decreases the amount of amyloid plaques in the brain in a manner that is analogous to this. Additionally, it appears that curcumin can assist in the elimination of a different putative protein known as tau, which accumulates within the neurons and is similarly associated with the development of Alzheimer's disease. However, the research is contradictory. It was shown in a short clinical experiment that the consumption of turmeric through oral administration did not appear to improve cognitive function or slow the decline of cognitive abilities in Alzheimer's patients. Treatment for arthritis. The most common treatment for osteoarthritis is the use of pain medications such as aspirin and ibuprofen. Osteoarthritis is characterized by pain and joint dysfunction respectively. Curcumin, on the other hand, is beneficial in lowering joint inflammation and pain in a wide variety of trials. Furthermore, it does so without the gastrointestinal side effects that are associated with non-steroidal anti-inflammatory medicines, NSAIDs, enhancement of the brain's health. Furthermore, curcumin has the potential to be beneficial to the brain in a variety of other ways. Because of its antioxidant and anti-inflammatory qualities, the polyphenol may also be useful in avoiding or alleviating the symptoms of other neurological disorders such as Parkinson's disease, Huntington's disease, multiple sclerosis, and dementia. The potential for mood enhancement. In a few limited clinical trials, curcumin was found to alleviate anxiety and lessen severe depressive disorder in the people who participated in the research. Because it raises levels of brain-derived neurotrophic factors, curcumin appears to have a positive effect on mood, according to Dr. Jampoulis. The protein known as the brain-derived neurotrophic factor, BDNF, is responsible for maintaining the health of neuronal cells. It appears that plant-derived polyphenols such as curcumin are responsible for stimulating the creation of this protein. According to her, BDNF is believed to be associated with neuronal regeneration. With that being said, there is a lack of research. There has not been a single study that has been conducted over at least 8 weeks to investigate the possible effects of curcumin. Protection against inflammation induction. Chronic systemic inflammation and oxidative stress are being widely recognized by researchers as underlying variables in a wide variety of serious diseases, including diabetes and cardiovascular disease. As a result of the antioxidant and anti-inflammatory properties that curcumin possesses, it has the potential to offer some protection against the disease progression of various chronic conditions. Curcumin has the potential to alter the composition of our gut microbiome in ways that are beneficial to both the mind and the body as a whole, according to one of the most recent lines of research, which focuses on the role of gut microbiota in either promoting or protecting against disease. Curcumin possesses characteristics that include antibacterial, antiviral, and anti-cancer capabilities, in addition to its 2 principal actions. Additionally, it can control the too strong immunological response that certain COVID-19 patients have, which is referred to as the cytokine storm. It is being investigated by researchers as a potential treatment as well as a prophylactic measure for COVID-19. The dosage of turmeric and its absorption. Just like with any other natural medication, it can be difficult to determine the optimal dosage that would be both helpful and safe to take. When it comes to a therapeutic dose of curcumin, Dr. Jampolis recommends taking between 500 and 1,000 milligrams of the compound daily. That's approximately 2.5 teaspoons. According to Dr. Jampolis, if you're looking for a therapeutic benefit for arthritis or mood or Alzheimer's prevention, I'd probably suggest adding a supplement. This is even though it is easy to take 2.5 teaspoons through culinary use. Another hurdle that still needs to be overcome is making curcumin accessible, which means that it must be able to be absorbed through digestion for us to reap the benefits of curcumin. The bioavailability of curcumin in humans is significantly increased by an extract of black pepper, specifically the alkaloid piperine, which is typically included in commercial nutritional supplements. However, you may achieve the same effect by incorporating black pepper into your recipes along with turmeric. To enhance the body's ability to absorb turmeric, the majority of recipes for golden milk, a popular beverage that contains turmeric, also include a dash of black pepper. If you are taking a curcumin supplement, it is recommended by Dr. Jampolis that you consume it alongside a meal that has a healthy fat, such as olive oil or avocado. The chemical known as curcumin is fat-soluble, which means that it does not dissolve in water, but rather only in fatty compounds. Moreover, this slows down the body's metabolism, which results in increased bioavailability of the substance. Through the process of attaching curcumin to fatty acids, Meriva, which is one of the more well-known commercial dietary supplements, provides a sustained-release formulation of turmeric. Turmeric's potential dangers and adverse effects on the body. Turmeric, when used as a spice in cooking, is completely risk-free. According to Dr. Jampolis, from a culinary point of view, it is highly unlikely that you will get into any trouble. People are encouraged to take the culinary approach as part of an overall anti-inflammatory diet, as expressed by me. Nevertheless, when administered at greater dosages, such as those found in some experimental treatments, 1,500 to 2,000 milligrams per day, it has the potential to create problems in certain individuals, including that there are clotting issues. Blood clotting may be slowed down by turmeric, which may result in complications following significant injuries or surgical procedures. In addition, because of this impact, individuals who are taking blood thinners prescribed by a doctor should avoid eating excessive amounts of turmeric. The absence of iron. In a study that involved vulnerable patients, excessive doses were found to interfere with the metabolism of iron. Sugar levels in the blood are low. As Dr. Jampolis explains, curcumin may enhance the effects of the sulfonylureas that are used to treat diabetes, particularly if you are an older individual. When this happens, hypoglycemia can develop. Stones in the kidney. Oxalates are organic acids that are naturally present in turmeric. Oxalates are known to enhance the chance of kidney stones forming in individuals who are predisposed to developing them. This includes nausea as well as other gastrointestinal problems such as diarrhea. The conclusion is that ginger and turmeric, which are both plant rhizomes and botanical cousins, have been staples of traditional Indian cuisine for a very long history. Turmeric, on the other hand, has emerged as a prominent figure in the field of natural health practitioners in recent decades due to the amazing curative capabilities that are typically associated with it. Melina Jampolis, MD, a nutritional medicine specialist, author of Spice It Up, Live Long, and member of the Forbes Health Advisory Board, makes the following statement. It is one of the most powerful anti-inflammatories and a very powerful antioxidant. It operates on a molecular level to downregulate genes that are involved in inflammation. It is not possible to find a single remedy or preventative measure that will be effective for all conditions, but turmeric is among the most effective. So this is the end of our today's video. Do you like it? Kindly give your valuable response in our comment section below, and don't forget to subscribe to our YouTube channel for more interesting and informative videos.